name's Doherty and I'm from MindWise's. Right, you're going back quite a long way now because I think I'm the oldest serving member of staff in the organisation. I started working with MindWise, or as it was called then, National Schizophrenia Fellowship, in 1990. So I coming up 23 years. That's a bit scary on it, and it was a totally different organisation at that stage in the game. Very, very small. We had offices in city centre Belfast, and the vast majority of the posts, of which there was only, I think, about 4, were funded through ACE, and that was an old job seekers programme at the time. And we had very limited funding. The focus was really around raising awareness of mental health issues, and particularly with a key aim to support people with severe mental illness living in the community. So a lot of work with some of the founder members of the charity at that time, who were mainly middle-aged women who had a son or daughter with a mental health problem and who weren't satisfied with the statutory services and certainly didn't want their children locked up for a long period of time. So the focus was developing activities within the community and securing funding to drive the organisation forward. So we very quickly developed up a reputation for good quality service provision that was service user driven and led, which was quite innovative at the time, because really the practice within the wider mental health arena was people with severe mental illness aren't able to do anything. They were heavily medicated, and the focus was on doing unto them as opposed to asking them what they wanted and trying to support them to achieve their own goals. So really that was our focus, and that's how we started then to influence and change policy and also practice within the mental health arena. Secured funding from the various different health and social care trusts across Northern Ireland, and started to develop up community-based services for people with severe mental illness. Yeah, great buzz about the place because most of the clients that we had at the time just really hadn't had the opportunity to integrate fully into the wider community. So really it was about supporting them to do that. So it was like, right, where are we going today? Let's go round to the art galleries, what's happening up in the Crescent Art Centre, let's go and have a mosey and see, let's go to the museum. And we did develop up quite a lot of art activity at that time. Now part of that was probably because I loved art and I had my first degree was in graphics. So I was delivering and facilitating arts programmes and whatever. But an awful lot of our clients were very, very creative, either through poetry, writing their own stories, telling their own personal stories, creative writing, or just the visual arts as well. So it was a great hub that way. We even did murals, actually. We did a big mural in the centre that we were in and developed an indoor-outdoor cafe society feel. It was lovely. But you have to remember there was no regulation, or the regulatory environment at that time was nearly non-existent. So we could be a lot freer in our thinking. I even had a creche going at one point. So anybody with a mental health problem who had children could still come to the service, and we had a creche dedicated in one part of the building, which again would be quite challenging to do now because of the heightened regulation. But it worked successfully at the time. It was great. So yeah, a lot less regulated, more opportunity for people to do what they want and to express how they felt, and more opportunity to move forward quickly with decision making and do more innovative stuff. But I suppose more risks were attached to that as well. I suppose the big change over the last 20 plus years would be the heightened regulatory environment. So everything is monitored, everything is scrutinised, risk assessments have become a big issue within the sector. Some of that really has moved away from the more, I would have thought that we were a lot more we were more prepared to take positive risk taking then as we are now. I think over the last 20 years everybody's become a lot more risk adverse, and you can't do anything unless you're risk assessed and updated the risk assessments. So I think that needs to change back again slightly, maybe not to the same extent as it was, but certainly people need to adopt a much more positive risk-taking culture and attitude. I think on a positive side though, the good thing that is starting to happen, but it is only starting to happen in the wider mental health arena over the last 5 to 6 years, is the person-centred approach. So I think right across the centre there's more an emphasis on looking at what the individual wants to achieve and trying to support them to do that through your practice, which ultimately is positive. So we're not just labelling people with a severe mental illness or a mental health problem and saying you're not able to work, you're not able to integrate into society, you're not able to have a relationship, you're not able to have children. You're more or less redundant from your 18 to 24 when the majority of the diagnosis is made. Now we're starting to say, or practice is starting to say across the board, well, just because you have a mental health problem doesn't mean that you can't achieve, you can still achieve. So I do have a lovely example of that from a wee fella who came into one of the services, but again this was my early days. He came in and had been recently diagnosed with bipolar, and I asked him what he wanted to do. And he said, well, my dad wants me to work. My girlfriend wants me to get a flat with her. My psychiatrist says I can't do anything because I've got a diagnosis of bipolar. And my mum's afraid of me doing anything because she doesn't want me to get unwell and go back into hospital again. So what do you want to do? You know, you've talked about everything that everybody else wants you to do, but what do you want to do? And he said, well, I'd love to be an artist. I like drawing, I like painting or whatever. And I said, well, are you going to do some of it? He says, well, I've started working up a portfolio, but I haven't shown it to anybody. I will sure bring it in and give us a kick. Let's see what's happening. So sure enough, he brought it in and some fantastic, oh my God, beautiful stuff in it. So he used the art room and started building up his portfolio or whatever. And then subsequently applied to University of Ulster and got into art college. Went on to do his masters. He sells his work professionally now. Also facilitates workshops, not only for people with mental health problems, but also with wider groupings and communities or whatever. He sells his work down south commercially as well as up here. And he's recently had a baby. And he's happy as a pig in shite. It's great, it's great, absolutely wonderful. So to me, that's the real person-centred, that's what should be happening right across the board.